Hello, and thank you for joining this PER Medical Crossfire titled Management of Adverse Events Associated with Therapies for Hematologic Disorders, Nurse's Perspective. We'll be discussing clinically unmet needs in the management of adverse events associated with treatments for hematologic malignancies, including the clinical relevance of timely identification and management of potential toxicities. We'll also address strategies to help clinicians anticipate problems that might otherwise adversely affect patient outcomes, thereby improving patient treatment adherence. The essential role of oncology nurses in enhancing patient management in the context of the multidisciplinary team will be highlighted throughout our discussion. This is a continuing medical education program sponsored by Physicians Education Resource and supported by educational grants from Ariad and Celgene Corporation, and is part of the Medical Crossfire series of online CME activities brought to you by Physicians Education Resource. I'm Dr. Michael Morrow, leader of the Myeloproliferative Neoplasms Program and clinical director of the Leukemia Service at Memorial Sloan Kettering Cancer Center, as well as professor of medicine at Weill Cornell Medical College in New York. Participating today on our distinguished panel are Sandy Allen Bard, leukemia nurse practitioner at Weill Cornell Medicine, New York Presbyterian Hospital in New York; A.J. Chari, associate professor of hematology and medical oncology and director of clinical research in the multiple myeloma program, and the Associate Director of Clinical Research at Mount Sinai Cancer Clinical Trials Office, the ICANN School of Medicine at Mount Sinai in New York. And last but not least, Patrick Spencer, Clinical Coordinator of the Multiple Myeloma Program at the Mount Sinai Health System in New York.